Hey everybody, it's Josh, and today I'm going to show you some basic lower back and hip workouts to help during the apocalypse. And always, this is Josh Got Bored. All jokes aside, right now in butt end of March 2020, there's not so much pleasantness going on. A lot of us are shelter in place, quarantine, what have you. So you're going to be sitting a lot, pacing a lot, doing a lot more sitting realistically than you normally do, or for some of you, might be about the same. Now this is going to put a lot of strain on your lower back, and you might have some issues with your hips because you're not working out these muscles. So sitting a lot, you're going to have some pain and mobility issues that are going to arise, especially if this current event goes on quite long. So what I'm going to do today is show you a basic set of exercises that will help with this condition. Now, I've had back and hip issues my whole life, so these are some workouts that I personally do. I'm just going to throw this out here. I am not a doctor. I am not a nurse. I do not have medical training in the field of kinesiology, sports medicine, or anything along these lines. The workouts I'm about to show you are ones that I have been shown by individuals who do have like bachelor's, masters in kinesiology, who have shown me. I find that they work. They're very low impact, but if you're not sure if it's something you can do, watch the video. If it just feels like it's something you shouldn't do, then don't do it. If it's something you question, if you've got Teladoc or some other system where you can call a professional, say, hey, this is the condition I have, check. But no worries, we're not going to do some crazy like psycho yoga or anything like that. So I'm just going to show you a couple basic exercises. You don't need that much square footage. I just have this yoga mat because it just makes the video look fancier. You just need a chunk of floor, ideally with carpet, just because it's a little more comfortable. So the first position we're going to start with is from laying down, and it's what in yoga is referred to as a half bridge, or more commonly it's referred to as pelvic thrusts. I call them making love to the ceiling because they look that awkward. So the first position, you're just going to lay down, hands by your sides, make sure you have enough room, and you're going to bring your knees up and your feet not quite to your hips, and you're basically just going to thrust your hips up. As I said, kind of awkward looking, but whatever. And you're just going to do this 10 times. The purpose of this is just a little mobility, working out the back just a little, and it frees your hips just a little. As you can see, I'm not really straining myself. It's not really affecting my speech. So, after that, we're going to switch to a kneeling position. And what we are going to do are what's called high kicks. Now, you want to make sure that there's nothing right in your way. So I'm going to move up a little bit. And essentially, I'm just kicking the air, doing a nice rotating motion, making sure my hands and knee are firmly planted, ideally hands shoulder width apart, and I'm just trying to rotate my hip up and back. And we're just doing 10 of these on both sides. Now, I'm not keeping very accurate count because I'm talking and I can't do two things at once, but these help. So after this, we're going to do a position called the hydrant. So, very similar. Now, imagine a dog you're taking for a walk. There's a hydrant. Yeah, so it's this. So this is just going to open the tendons through here in your hip flexors. And you're going to do 10 of these. Then you're going to switch to the opposite side, making sure to have enough room from the wall, which I did not do. So, as you can see, not very intense. And then the final one in this position is we're just going to rotate the hip. So much like the hydrant, but we're just doing a rotation. The best is to come towards the chest, come out, back, down, align again with the body, forward. Now you can do it the opposing way if it's more comfortable. If you want to do 5 one way, then 5 the other, by all means. Then we're going to do it on the opposite side. The bigger the rotation, the little more you're going to get out of it. So if I'm only doing this, I'm not going to get as much as if I do a wide rotation. If it doesn't feel comfortable, listen to your body. Your body is smarter than you. If it hurts, it's probably not the best thing. This doesn't necessarily apply to getting needles for medicine, but if it hurts, don't do it. Now, the final exercise is probably the most horrible one. Now, this one's not particularly difficult, but it does suck. So, you're going to take a timing device. I like to use my phone. And we're going to do a 30-second squat. Yeah, no, you didn't mishear me. We're doing a squat for 30 seconds. Now, this part is very important to do, so I wouldn't skip it. Now, if you don't feel very comfortable doing a standard squat, you can do what's called a wall sit. So, with your feet shoulder width apart, you're going to flare out your butt, rounding your spine a little bit. If you bring your hands out, it's a little easier. Now, you don't have to go all the way down here, because this is rough. You can do it higher, or even if this is all you can do. Now, the wall sit, which I'm just going to use this for, because it's going to mess with my grip. So, my feet are a little farther than hip apart, well, shoulder width apart, and I'm just putting my back against the wall, making sure that the small of my back has a little bit of room. My butt is touching, my shoulders are touching, straight spine. Now, this one, not as effective as the squat. That's why I'm saying that's the most effective. So we're just going to do a 30-second. Okay. So this might be lower than you feel comfortable with. I do recommend the hands forward because it adjusts your spine. You might feel like you're leaning forward. If you put your hands out, you'll fall. So by just doing this, my spinal alignment's a little bit better, and I want my butt sticking out in what Jimmy would call a ghetto booty fashion. So that is a minute. 30 seconds. So, yeah, that's it. Takes about a minute or two to do this. I'm sweating a little bit because the room's all closed up, what have you, but you might a little, especially if you're not used to working out. But this is going to relax your lower and mid back and open your hips. Because with all the sitting you're going to do, this is going to be a thing. So do this once, ideally first thing in the morning, and you'll be a lot looser throughout the rest of the day. Now if you feel tension starting to build up midway through the day, just do it again. Anyways, like I said, not a doctor, not a professional. Contact your doctor if you think this is something that you can't do. If you just don't feel comfortable, then don't do it. Safety first. And always, thanks for watching.